How are you? So happy that you guys could make it today, and hoping that you can hear me properly. Hi, can you hear me? I mean, you can see me now, right? Okay. All right. Okay, that's great. I'm hoping that you guys can hear me properly, and I'm so glad you guys made it today. Now, I know for some of you it's a Saturday night, and it's a time to party and go for a movie or do all the stuff which you would like to do normally. But I appreciate you, and I'm very, very proud of you for saying that, okay, I can do that later once I become an RN, and coming here today to learn. So that's awesome. All right. So hi there. Hi. I'm so glad. I wish I could see you guys. I mean, just see your faces, but that's fine. All right. Okay, so today we are going to talk about some of the important topics, and might take around 40 minutes to an hour, and I'm hoping that you guys are going to make it for the entire thing. And before we go to the actual topics, I want to share something awesome with you guys. I mean, these are the recent RNs from Apple RN. Okay, so I really want to congratulate these guys, and and want to tell you that how proud I am for each one of them, because almost I know them personally. I can tell you that. There are some of them which maybe I haven't seen because the online students, I don't really see them, but I really, really know them. I mean, from the student point of view. Okay, I may not know everything about their personal life, but most of the things I do, because I keep in touch with them, and I try to give those individual attention to each and every person. It's a lot of students, but I try to do that, and there's a reason for that, because I think part of Apple RN's success is the motivation which I give to the people, or the individual attention which I give to them, and I really, really enjoy, being with these students, and also really enjoy when they call me back and say, I passed the test. That's the best moment for me. And, and it's like, oh my God, we made it. We went through this one. And it's one life, one family, which is going to get all the benefits. It's not just one exam or one person. It's just the entire family who's behind this exam, one person's exam, and they all are going to get such a great life after, passing that exam. So means a lot to me, and I really, really congratulate all these people. Thank you so much for, choosing Apple RN. And these are the recent people. I haven't included everybody because my slide was getting full. So I just wanted to share with you my happiness on, these new great results. Now, the thing is, I want all of your pictures coming here, because that will be awesome. That's my what do you call, the satisfaction from teaching, when I can put your picture here saying that, congratulations guy, you made it, congratulations girl, you made it. That's the awesome thing. So waiting for that. Okay, all right, so let's get started. Now today we are going to talk about some of the basic stuff. Okay, now when I say basic, don't think that they are not important. Now basics are always important. Okay, your fundamentals are always important. Now I have had some experiences from the students that they concentrate so much into all these biggest long named disorders. Okay, and they study about that and they forget the basics. Now NCLEX is also going to ask you about basic stuff. So I don't want you to think like, okay, this is just basic skills and procedures. This is, just fundamentals in nutrition. And this is just about, some of the health assessment, which we do probably in first semester in nursing college, But those are important, because NCLEX can ask you about those things. Okay, NCLEX will ask you about those topics. So today we are going to cover a little bit of basic stuff in a question format, so you will at least know those specific topics. When it comes to your exam, you are ready. Okay, so let's do that today. All right. Hi. So good to have you all here. So good to have you all here. Okay, let's get started then. The hospice nurse is assisting a client's family in managing anorexia during end of life care. Which interventions would be most supportive? Select all that apply. Now, if you have been here before, you know how this work. Okay. If not, please listen to me. You won't answer anything in the chat window. Okay. What I'm going to give you is I'm going to give you a poll. Okay. So it's going to look something like this. Okay. So you will get something like this in your screen. And what I would really suggest you do is you look at the options. So your 1 is going to be A, 2 is going to be B, 3 is going to be C, 4 is going to be D, and 5 is going to be E. And then I would like you to click here, whichever one you think is the answer. Okay. Now, do not worry. I don't know who you are or who is clicking what. Only thing I'm going to get is a percentage of how many people answered A, how many people answered B. Okay, so don't worry, just go ahead and answer it. Okay, nobody is going to know that you did this. I appreciate that you guys are just, trying to click on the answers, but let's go back to the question because I don't think everybody got a chance to actually read the question. So let's do. The hospice nurse is assisting a client's family in managing anorexia during end of life care. Which interventions would be most supportive? Select all that apply. Now, this is a SATA question. Select all that apply question. So, there is more than one answer, right? All right. So, let's do. Number 1, administer nausea medication prior to meals. 2, offer food items the client desires. 3, restrict visitors for uninterrupted meal time for the client. 4, prepare 3 highly nutritious meals a day on a schedule. And 5, involve the client in daily meal planning. So there are 5 options and it's a select all questions, so which means that there is more than one answer, right? So I want you to think about that. Keep that in your mind. Okay. And I would like you to go ahead and click now. Okay. All right. Okay. Go ahead. And if you want to see it again, the question again, I can show that. Okay. Here we go. Okay. We'll discuss it, but I just want to see, what kind of answers do you guys get? All right. So let's see. First of all, I have all the answers. I mean, so many of you, I think 65% of you guys, almost. It's going up again. Okay. All right. Okay. All right. The most answered, 73% of people answered B, E, and half of you guys answered A, C, and D. And only 13% of the people answered F. Okay. So the most majority of answer we are getting here is A, B, C, D, and E. Okay. A, B, C, D, and E. So 1, 2, 3, 4. Okay. So these are the 4 answers most of the people answered. Number 1, number 2, number 3, and number 4. Okay, let's see. What do we know about end of life care? That's the first question we need to remember. What is end of life care? In end of life care, are we looking at curing the disease or are we looking at making the people comfortable? Can somebody type that in? In end of life care, are we looking at making comfortable or are we looking at curing the disease? Making them comfortable. Yes, that's right. Making them comfortable. End of life means we are not looking at treating the disease anymore. It's all about making them comfortable. Right? And what is anorexia? What is anorexia? This term. Go ahead. Somebody can type in. What is anorexia? Eating disorder, okay. What kind of eating disorder, Marilyn? I mean, is it eating a lot or eating less or throwing up after eating or lack of appetite? Yes, that's right. Anorexia is lack of appetite. Okay. In this one, as you can kind of predict, it's an end of life care, which means I'm thinking that this patient has some really bad disease which he or she is not feeling like eating at all. Maybe it's a cancer. Maybe it's something with severe COPD. Maybe it's severe end-stage renal failure where the patient is going to die. We don't know. But end-of-life care means it's towards the end of it and there is no appetite. The patient doesn't feel like eating at all. Okay. And what is the question asking us? Which interventions would be most supportive? Which means we are looking for something good we should do for the patient, right? Something we should arrange, something we should do so the patient will feel like eating, right? That's the question it's asking us. Now, what is something which the patient can, patient feel like eating if you do something like that? So let's make this, options into a true or false statement so we can answer it. For every select all that apply questions, that is the technique I would like you to remember. Okay, change the option into a true or false statement. For example, here I'm going to say, for an anorexia patient in end-of-life care, I will administer nausea medicine prior to the meal. True or false? What do you think? Administer nausea medicine before meal. True or false? True. It's a good thing to do, right? Because if you give nausea medicine before the meal, chances are that the patient is not going to feel nauseated or not going to feel like vomiting. So the chances are that the patient is going to eat something. Don't you think so? Yeah, it is a true statement. So if it is a true statement and we know we are looking for something good, right? Which intervention would be most supportive? Which means you do something to help the patient. Okay, and this is a true statement, so we are going to keep it. So one is a good thing to do. So let's keep it. Now the second thing, for a patient with anorexia in end-of-life care, I will offer food items the client desires. True or false? What do you mean by the client desires? Client desires means the client feel like. What does the client really want to? What they would like to eat? Yes, that's true, Madeline. That's true. So whenever there is, when the client feel like eating, when the client desires to eat, which means they are good things, right? I mean, he feels like eating that. So is it a true or false statement? Is it okay to offer foods the client desires? True. It's a true statement. Because remember, in end-of-life care, we are not looking at curing the disease anymore. It doesn't matter if the patient is diabetic. If he wants to eat, a dessert, give it to him. It doesn't matter if the patient has congestive heart failure. If he wants to eat something with sodium in it, give it to him. He is in end-of-life care. Okay? You are not going to restrict the food which he would like to eat because the problem here is anorexia. So we try to give him the food he wants to eat. Okay? So this is a true statement. So we are going to keep it. So 1 is good, 2 is good. Now we are going to the third one, okay? Restrict visitors for uninterrupted meal time for the client. Now this is where most of you clicked yes, but let me tell you this, okay? It is better for a patient in end-of-life care to have family and friends coming and sitting with them while they are eating. And if possible, let them all eat together. Okay, just think about in your case. Just think about you. When do you feel like really enjoying the food and eating more food? When you are surrounded by family and friends, right? And when you are, you're sharing the same table with everybody, so everybody is eating. Yeah, that makes you feel like, okay, sometimes it's a very hard thing to stop eating, right? I mean, it feels like, oh my God, I have eaten this much. I mean, I have been sitting here for 1 hour and eating because we didn't know the time just passed and we were just talking and having a good time with everyone, and we just started eating, right? I mean, very bad thing when you are trying to lose some weight, okay? But not here. In this situation, it's end of life care. And we don't mind what the patient is eating because all we are concerned about is let him eat something, right? So do not restrict visitors when they are in end of life care. And especially about anorexia, if they are experiencing that, they don't have appetite. Anorexia means less appetite, right? They don't feel like eating. They are not hungry. They don't feel hungry. So it may be a good idea to have the people whom they love and share. So, and visitor, who are visitors usually? Family, friends, right? People who really care about them. Okay, so let them be there. Let them eat with the patient. Share the meal. Okay, and that will really help the patient to eat better. Okay, all right. So that's one thing I think many of you got wrong. So just keep that in your mind. All right. So let's see the next one. Prepare 3 highly nutritious meals a day on a schedule. Many of you said yes to this one. But I would say no. This is a false statement. You know why? In end of life care, patient with anorexia gave them 3 highly nutritious meals on a schedule. True or false? So when I change it into a statement, what do you think? It's false. Why? First of all, they are not going to feel like eating a big meal. When it is only 3 times a day, I'm thinking that it's going to be a big, 3-course meal. And do you think the patient is going to feel like eating that big of a meal when he is already having anorexia and is in end of life care? No. He might try or like to kind of nibble on something, just a little bit there, a little bit here, I will have a little bit that, or maybe 2 hours later I will have some of that. So the best thing to do for these patients is small and frequent meals. Yes, Madeline. Small and frequent meals, that's the better thing. Okay, so when we say, I think many of you got carried away, okay, with this thing, highly nutritious meals. See, you have to really read the entire option and make it into a true or false statement whenever you can when you have the select all that apply question. That will help you to focus. Okay, 3 highly nutritious meals is good thing, but 3 highly nutritious meals on a schedule for a patient with end of life care who is already having anorexia is not a good thing. Make sense? Okay, so remember that. So in this one, 3 is false, 4 is false. Now how about 5? Involve the client in daily meal planning. Now, if some of you might have kids at home, okay, and some of you might have kids like 3-year-old, 4-year-old, or 5-year-olds at home, well, even teenagers at home, so you know how picky they are, right? I mean, you make something really good and give it to them, and highly nutritious and something really you took the time to cook, and they will say, I don't want that. I don't feel like eating that thing, right? Right? Very picky people. Yeah, I have some at home too. Okay. So what do I do for that? I give them choices. Okay. Well, choices which I can make. Okay. And then what I will tell them is like, okay, you have this. Which one would you like to have today? So that kind of gives them some control. They feel like, okay, they made the decision. And it also helps me to make something they like. There's a higher chance of them eating that thing, right? So it's always better to involve the client in the meal planning, especially when you don't have any restrictions. So it's easier because this is an end of life care and we are not looking at curing the disease. We don't mind what they are eating. Let them eat whatever they can have. In that case scenario, very easy to include them in the meal planning because they can choose anything and you can make anything, right? Yeah. So involve the client in daily meal planning. Okay. So in that case, what is our answers to this question? Number 1, number 2, and number 5. So you have 1, 2, 5. Good job, Anmol. Good job, Julia. So you guys got this select all that apply question right. Okay. Very, very important to remember that. Did you learn something from this? See, this is a basic thing. This is a basic nutrition end of life care. But these are the questions you are going to get in NCLEX. Okay. Now, I'm not saying you should not study the big disorders and their signs and symptoms and the management. It's great to know that, but it's also good and it is important that you know the basic stuff. Okay. So that's one. All right, guys. So let's move on to the next one. You ready? All right. Let's see what is the next one. A post-operative client with obesity and diabetes mellitus, has an abdominal wound and is at risk for poor wound healing. Which interventions would the nurse include in the plan of care to prevent wound dehiscence? Select all that apply. Now I want you to read the question, okay, at least 2 times. So you understand what exactly is the question asking you. And before you decide about the options, I want you to think. This is how I want you to think. Am I looking for something good or am I looking for something bad? Very important to understand that. Okay. This is critical thinking application. Very important to understand that. This patient is post-operative with obesity and diabetes and has an abdominal wound and a risk for poor wound healing and wound dehiscence. Which interventions would the nurse include in the plan of care? Now, when do you include something in the plan of care? When you really want them to do something. It's something good you should do. Right? Yes, animal, good. Good thing, okay? So select all that apply, which are the good things. 1. Administer Docostate orally daily. Excuse me. Administer ondansetron, IV PRN for nausea, which is Zofran. You might know about that as Zofran. 3. Apply an abdominal binder. 4. Implement caloric restriction to promote weight loss. 5. Monitor blood sugar to maintain tight glucose control. Okay, guys, what I'm going to do is I'm going to give you a poll. Okay. There we go. And you can select your answers. Now, if you want to see the question again, here we go. Excuse me. All right. Okay, let's see. Go ahead. All right. See, I can see that some of you are still not replying, okay? So go ahead and click whatever you feel like the best thing to do, because this is your, guys, it's better to make a mistake here, okay, in front of me, with me, rather than sitting there for NCLEX and making a mistake, okay? So get that fear out of your mind. You need to really practice doing questions, and this is your better way to do it. So go ahead and do your clickings, okay? You want to see the question again? Here we go. Okay. And there's a survey. Go ahead. I mean, there are many of you are still not answering. I can see that many of you are still not answering. Okay, go ahead. Even if it is in a mobile phone, you know, you can just touch screen. So just click there and it will get you. All right. So many of you said the most answers which are here is A, B, E. A, B, C, and E. I mean, C and D are like, so let's see. A, B, E. All right. So first thing which people said is administer Docusate orally daily. Okay, before we go into that, do you know what wound dehiscence is? This patient is a post-operative client, which means they have a surgery. And it's, I think, some kind of abdominal surgery, right? Because it says it's an abdominal wound. And the patient is obese. So I'm thinking maybe they had some gastric bypass or something like that. And diabetes mellitus. Well, you know, when the patient is having diabetes, there is a delay wound healing, right? Poor wound healing. There's a chance for that. So when the patient is obese and has diabetes and has an abdominal wound, there is poor wound healing. There is a higher chance of this patient having wound dehiscence. Now I'm going to show you a picture. And I don't like this picture, but I have to show you that, right? See? Do you see this? I want you to remember this is wound dehiscence. This is poor wound healing, and it's not closing, it's opening, right? It's not closing completely. There is no healing going on. Now, this is what happens when the patients have chronic diseases like diabetes, okay, or poor nutritional status, or long-term corticosteroid therapy, poor wound healing. Now, this one, I want you to remember this, term, evisceration. Okay, this is wound dehiscence. If you look at this picture, you can see that the intestine is coming out, right? The abdominal contents are coming out. So whenever the abdominal contents are coming out, you use the term evisceration. Okay, please write it down. I hope you guys have a notebook or something like that, because it's very important to remember these terms. And you are going to thank me later when you are actually sitting in front of the NCLEX exam computer and you see the term evisceration and you're going to think, I know what that is, right? So that's going to really help you. Okay, so write it down. Evisceration means the abdominal contents are coming out. Dehiscence means there is poor wound healing, there is opening here. Okay, that's the difference. All right, so now you know what is wound dehiscence. Okay, how can we answer this question? Which interventions would the nurse include in the plan of care to prevent wound dehiscence? Administer Docusate orally daily. And what is Docusate? What is Docusate? Anybody? Can anybody type in what Docusate is? A very commonly asked medication in NCLEX. So remember this one. Stool softener. Yes, yes. It is something we use to prevent constipation. At least if you can remember that, you will be fine. Because, good job, Simu, Julia, Madeline, Merlin, Blasi. I'm so glad you guys know this one. Docusate is something you can give to prevent constipation. And why do you want to prevent constipation? Because there is an abdominal wound. Think about this one. There's an abdominal wound. And if you are constipated, you know, you're going to strain to have a bowel movement. And that's when we say it's a Valsalva maneuver, right? Bearing down, prevent straining. So to prevent that, good job, to prevent that, you want to give them some kind of stool softeners or some medicine which will prevent constipation. Because if they put pressure or bear down to have a bowel movement, you are actually increasing the intra-abdominal pressure, which can open up this, this wound right here. Okay, not good. All right. Another thing, administer medicine for nausea. Why do you want to give something for nausea? The same reason. Because when you are retching, you know, when you are nauseated, and if you go into like vomiting, and if you have vomited before, you know how much, you know, how bad that feels and how painful it's going to be on the patient with an abdominal wound. Not only that, it is also going to increase the pressure, the intra-abdominal pressure. How do you vomit? How do you retch? Like, you know, you take everything from the stomach and, you know, try to do that, right? So the intra-abdominal pressure is going to be high, which is not good in these patients. Okay, so this is true. All right, prevent wound dehiscence. I will administer stool softener. True or false? True. To prevent wound dehiscence, I will administer nausea medicine. True or false? True. Okay. Next one. Good job. Next one. To prevent dehiscence, wound dehiscence, abdominal wound dehiscence, I will apply an abdominal binder. True or false? Now, you know abdominal binder, right? You know, just the kind of something to hold the abdomen in place to help to, keep the edges of the wounds in place. It's a true statement. It's a good thing to do. Because especially somebody is obese, you know, when there is, it's already said there is obesity. And I'm thinking that they have a huge abdomen, you know, or the abdominal area is, you know, large. So it's very important to keep that wound, you know, like closed up like that. So when you have that abdominal binder, it really helps with that. Okay, so this is a true statement. So I'm going to keep it. Now, next one. For a patient with abdominal wound, to prevent dehiscence, I will implement calorie restriction. True or false? What do you think? True or false? Hi, Lena. Good to see you. I mean, not see you, but I'm kind of there. Okay, it's false. Why it's false? Because, you know, even though I understand patient has obesity, patient has diabetes, I mean, that's okay. I know that's really bad, but this is not the time to restrict the calorie to promote weight loss. This is not the good time. This patient just had a surgery, probably a major surgery, and they already are at risk for wound healing. So very important to give them enough protein, enough nutrition at this acute time. Okay, because we are not looking at, you know, weight loss now. We are looking at getting this wound healed. Okay, and we will look at weight loss afterwards. It doesn't mean that the patient can just keep on eating whatever he wants to eat. Okay, I'm not saying that, but I'm saying implementing calorie restriction to promote weight loss is not a good idea at this time. Okay, so we are not going to take it. It's a false. Now, next one, monitor blood sugar to maintain tight glucose control. Is it good or bad? For a patient with wound dehiscence, I will control the blood sugar to maintain tight glucose control, especially in a diabetic patient. Yes, yes. It is important because hyperglycemia can lead into poor wound healing. So very important to, and the infection, the risk of infection. Okay, the risk of complications are higher when there is no glucose control. Now, if you have, a notebook or something, I would like you to note down these topics. I mean, these little tips, which will really help you to, understand wound dehiscence. Okay, and wound dehiscence is a complication of wound healing. Now, do you remember the other term which I wanted you to remember? What was that? Evisceration. Okay, hope you remember that, because that means it's not just the wound healing. Evisceration means it's actually the things are coming out, you know, the abdominal contents are coming out. Okay, good job, good job. So in wound healing, wound dehiscence means, you know, the surgical wound is failing to approximate. Now you use the word approximate, you know, like, you know, when it wants you to unite or connect. Okay, that's the approximate. In this case, see, it's not approximated. It's not. Okay. All right. So that's what wound dehiscence is, and the factors which is associated with it, you know, it's poor circulation problems. It can be diabetes, it can be smoking, it can be obesity, it can be advanced age, like, you know, elderly patients. It can be malnutrition, it can be an infection, it can be steroid use. So in this question, you know, instead of this diabetes mellitus, if I had anything like smoking or elderly patient, or I'm saying that this patient had long-term corticosteroid therapy, or I'm saying this patient had a terminal illness, cancer, or if I say this patient has malnutrition. So anything here, I want you to think about that. Okay, it is going to be a risk factor for wound dehiscence. So anything here. And it can also be mechanical stress on the wound, and that's where we apply the information, right? Training to cough, training to have a bowel movement, training to vomit. And another important thing, give them a pillow to hold to splint the abdomen. I will show you a picture of that. See this one. Okay, so when the patient has to cough, give them a pillow like this so they can hold on to it and then cough. Okay, now this will act like an abdominal binder, kind of. Okay, so this is a splinting abdomen with pillow. This is a good thing to do. All right, very comfortable, and it will reduce the risk of, opening up the wound. Okay, so this is what called splinting the abdomen with pillow. All right, select all that apply question. I want everybody to give your maximum here, okay? After completing your recent NCLEX RN exam, hi Noel, thank you Noel. After completing your recent NCLEX RN exam, you are explaining the reason for your failure to miss NCLEX assignment, that's me. Which of the following are correct responses? Select all that apply. I don't want you to answer this in here, okay? I want you to ask this question to yourself, all right? 1, I did not have the time to study properly as I am working and I have to take care of my kids, or I have to take care of my parents, I have to take care of my husband or wife, or I had to take care of somebody in my life. So I didn't have the time. Second one, I was invited to the wedding, or I was invited to the church festivities, or I was invited for a reunion, or I was invited for the community project. I was invited for a get-together. It's a Saturday. Come on, I have to go for the get-together, right? So I couldn't avoid that because I'm very worried about what others are going to say. What if I go for that? If I don't go for that wedding, or if I don't go for that reunion, and instead if I am studying here, what will people say? Number 3, I'm too old to study and understand all this. Let me tell you. One of my students who recently passed NCLEX RN, she was an online student. She was 56 years old and she is a grandmother and she is a single parent and she works as a PCA. And if she can do that, don't tell me you cannot do it, okay? Just telling you that. All right, you are never too old to study this. The way I am teaching you, it's very simple explanations, okay? So you should be able to get it. All right, 4th one, this is my 3rd time writing the exam, or the 2nd time, or the 4th time, or the 5th time, I don't mind. I knew I would fail. There you go. Okay, I knew I would fail. 5th one, I should have used the other class, the one where they stay, or the one where they give all the 3-month course, we stay in a place, or the one where it is like $10,000, or the one where across the city, or the one where they give all the good books, or the one where they have some kind of software where they take the questions from the NCLEX, actual NCLEX, and then give it to you. I hear all those things. Okay, that question bank, that I didn't do that. That's the problem. The grass is always greener on the other side, isn't it? Okay, so what do you think is your choices? Okay, who do you think is responsible? Now let me tell you about the time. If you don't have the time to make it right, to do all the correct things right now, if you don't have the time, when do you think you are going to have the time to do it over? Because you are going to do it over. If you don't do it right at this moment, when you have it with you, I'm telling you, you should just plan ahead and make the time to do it over. Okay? And I'm telling you, that's not worth it. I can tell you that. Okay? I'm very, very confident in telling you that if you really study the way I am asking you to study, you will pass the exam. But you have to keep all your excuses aside, because I cannot deal with that. Okay, everybody in this world gets 24 hours, guys. God is giving you 24 hours a day. That's the same for me, same for all these people, okay? Same for all these people who made it. There were people who did it like it's second or third time. There are people who are older than you. There are people who are actually working and did it. There are people who are not as intelligent as you. There are people who couldn't pay the entire money and they did whatever they can. There were people who were actually very much international students that they didn't know any English. So don't say all those excuses. You are not worth your excuses. You are worth your success. You are worth your efforts. You are worth your hard work. And God has given you the best thing you can have. Okay? And I'm so happy to have you here. I will do everything in my ability to help you, to motivate you, to follow up with you. But the work has to be done by you. I cannot write the exam. I already did it. Guys, I did a lot of exam. I did my RN and I did 2 more RN stuff, like I'm a medical surgical RN, and I did my CVRN, and I did my master's exams, and now I'm doing my PhDs. So I cannot write the exam again for you. It's you. Okay? It's you who has to work. So please be careful at what you choose. Okay? Don't worry about what others say. If you don't go for that get together, if you don't go for that reunion, if you don't go for that wedding, or if you really have to go, go and come back as soon as possible. Just don't linger around. Just your time is very important. Okay? Very, very, very important. So please don't waste your time. Okay, now the people who actually is on my online class, the 42-day schedule class, you know how it is scheduled by me, right? Every other day there is an exam for you. Very important you take that exam, and please see that exam review video. Every exam day after you take the exam, after you review the details of your exams, review the answers, there is a video. Okay, an exam review video. I want you to actually see that every time, because in that video I'm explaining to you why this answer is right, why this answer is wrong, just like we did the class today, right? And that video is very, very important, because NCLEX is not just theory. NCLEX is not just content. NCLEX is not just remembering things. You have to learn to apply the knowledge. And you must have known that now, right? Because after doing all these questions together, you must have had a chance. So be there, and I'll be there. And anytime anybody needs to ask anything, you can always contact me, and you know my number. Okay, and if you use any other, you can go to www.applrn.com. You can just go there and you can contact me from there too. So anytime, and especially if there is anybody who is going to write the exam sooner, all the best to you. Remember our little talks. Make the best use of your time. Okay? And email me if you need anything or any help. I will be more than happy to help you. And you know what? Keep me in your prayers. I'm keeping you in my prayers, because there is somebody above there who can do miracles. Okay, and I believe in miracles. All right, guys, take care. Bye-bye.